You know, Tim, they call tree work dangerous, but it's really high risk.
Nothing is dangerous when you know what you're doing.
And one of the things about knowing what you're doing is planning for an aerial rescue. Tim, one part of planning is making sure you have a first aid kit and a cell phone on the site.
It's important too, John, that the job briefing has the correct address on it as well.
You know, Tim, not all aerial rescues are the same.
No, John, sometimes a worker might just need a little help getting down. Something as simple but as life-threatening as heat exhaustion.
That's right, all they need is a little help from a coworker.
But if you're going to be any help in an aerial rescue, you absolutely have to have first aid training. So let's go over some of the basic requirements for first aid training for arborists. One of the first needs is respiratory arrest. This occurs with drug overdose or drowning. Fortunately, not too common occurrences and usually not aerial, of course. Cardiac arrests do occur. These are the heart attacks, and we have had years where as many as 3 arborists did suffer heart attacks in the air and did require medical attention. Hemorrhaging is the most common one, and obviously hemorrhaging is severe bleeding, and this is often a result of lacerations. Jagged cuts, most commonly chainsaws, but also handsaws. Amputations in the air are not very common. These often occur on the ground, but nevertheless the need for training is important. Musculoskeletal injuries are very common. These involve strains, sprains, dislocations, fractures, all of which can occur in the air and require very particular forms of first aid. So we'll be covering these in much more detail. Shock is another one, and for us, shock is loss of blood. We do receive eye injuries each year, usually a small sliver that goes in. Burns, and ours are electrical burns, and unfortunately a far too common event. All these types of injuries we covered can result in loss of consciousness, and you need to know what to do if an arborist loses consciousness while in a tree. And one of the other ones that we see a lot of during the summer is injuries due to extreme temperature exposure, typically heat. And obviously there's a very important need to know CPR. CPR will not be covered in this video, of course, because this is aerial rescue and CPR requires a flat surface and cannot be even started while in the tree. Very common need for an aerial rescue, but one in which you just have to support a fellow worker, is heat exhaustion. For this, you certainly want to call 911. But after making a call, is it safe for you to do so? You do need to climb up to the worker and assist them in coming down, because the sooner they're on the ground, the sooner we can begin to hydrate them, also loosen clothing, get them to lie down, and provide a little bit more comfort while EMS is arriving to assess it. When you do get up to the worker, do the initial assessment. Have them remove their glasses so you can take a look at their eyes. One of the things that you'll find is that the pupils will be dilated, but some of the other things you need to look for is the skin will be cool and moist. Maybe you have goosebumps. They may even be shivering a little bit. In addition to that, they'll be sweating very heavily. They may feel faint, and so this means they need a little assistance in coming down. Their pulse may be a little weak. Now that's going to be hard to check. They also may be a little nauseous and have a headache. The importance here is you do need to get them down on the ground and begin providing a little first aid, because if this is not treated, it may lead to heat stroke.
Well, that rescue went rather well, didn't it, Tim?
It did, John. He did everything right. He went up, he assessed the person, he made sure he was okay, he brought him down safely.
That's it. It doesn't have to be that complicated.
Nope.
But one that can become more complicated would be a neck injury. Neck injuries are very common among climbers, usually from being struck by a limb or even a branch. The symptoms of someone who suffered a neck injury can include a headache, moderate to severe pain around the neck area. That pain may also radiate to the arms and shoulders. In time, there may even be swelling or bruising around the neck. It may also become very tender to the touch, and there may even become decreased feelings in the arms and legs. There may also be a little muscle weakness or paralysis occurring, but sometimes these symptoms may not occur until several hours afterwards. If a worker suffers a neck injury, one of the first things, of course, is to assess from the ground and call 911. If it is safe for you to do so, try to enter the tree and assess the climber while they're still in the air. Try to minimize their movement. Tell them to hold very still and go through the initial assessment that we do in first aid, checking their eyes, because the eyes can tell a lot. If the patient is breathing and there is no bleeding, it might be best just to secure the patient in the tree and wait for EMS. Unnecessary improper movement may result in far more serious injury. In fact, 25% of our spinal injuries often occur after the incident. So unless there's an immediate need to do so, leave the patient secured in the air and wait for EMS.
So John, what kind of incidents we see working out of aerial lifts?
Well, you know, a wide variety of them, Tim, but one that we see, which unfortunately is a fatality every year, but we have a lot of injuries, is bee stings.
But either way, the crew still has to react in a safe fashion.
Absolutely, and in this case too, they need to know if that person's allergic.
Bee stings can result in such a mild reaction as just a slight swelling at the site where the person was stung. There can also be a moderate reaction where we just have a little redness and swelling at the site. But far more serious are the severe reactions where the person develops hives, has difficulty breathing, the throat begins to swell up, their pulse becomes very weak and rapid, and they may lose consciousness, all within minutes, in fact, even seconds. On a hot summer day, a ground worker might look up and find that the aerial lift operator is suddenly fighting off some bees. If this happens and the person is stung and loses consciousness, one of the first things to do is call 911 to get help. After the call is made, if it's possible, quickly get up on the truck and bring the injured worker down. Since they're unconscious, you will not know the extent of their injuries until they're on the ground. Obviously, you want to make sure you don't compromise your own safety when doing so, but the sooner they're on the ground so you can assess their injuries, the better. Once down, get up there, assess the patient. If it is someone who's been stung by a bee and they are allergic and they have an EpiPen, at that point it can be used.
You know, Tim, that worker did a great job responding to that incident.
It was perfect. He was concerned about his own safety. He actually stopped, looked up to make sure there were no wires before he got on the truck.
Right.
So John, what would we do if we didn't know what caused the injury?
Well, it's a very common scenario, Tim, and if we don't know the extent of the injuries, we want to minimize the movement of the patient.
Let's see how that would look.
Another common struck by injury involves the spine as well as the neck, and again, these may also occur when a worker is struck by a limb while aloft. When this happens, they may end up having some numbness or tingling, particularly along the back. They may have the inability to move their arms or their legs. They may also experience difficulty breathing and, of course, have back or neck pain. Anyone with spinal injuries has to be moved as carefully as possible. And we also need to get them to the ground as soon as possible since they are having difficulty breathing. When you're going to move somebody that has these type of injuries, particularly if we also have blood involved, make sure you are observing proper body substance isolation, BSI, and putting on your gloves before contacting their body. If the worker is unconscious or not breathing properly, you may need to get them on the ground before EMS arrives. When doing that, make sure you move them as carefully as possible. Get them onto the ground and then allow EMS to take over. They may ask your assistance in also stabilizing the head as they go through their assessment to determine the exact extent of the injuries of the patient. Assist them in any way they ask as they're going through their assessment. Once they've gone through their assessment, they'll end up packaging the patient properly and then transporting to the hospital.
You know, Tim, this really showed the value of EMS.
It did. I was really surprised at how little they had to move the injured person to get them prepared and packaged to go in the ambulance.
Absolutely, transport's important, and now let's see what the outcome was at the hospital.
And now we're at the hospital, and this illustrates the three key components to responding to an incident. First of all, number one, discovery and calling 911. That's up to you.
Second, the arrival of EMS that stabilized and packaged the patient. And then finally, the arrival at the emergency room. Obviously, you're a key component because nothing happens until you call 911.
Es importante que un miembro de su equipo de trabajo pueda hablar inglés cuando llame al 911.
Electrical shock is a very common incident among tree workers. Electrical shock involves the movement of electricity through the body. Symptoms of this can be as simple as just numbness or tingling or muscle pain, but they can be much more severe: heart rhythm problems, cardiac arrest, severe burns, and loss of consciousness. Any type of electrical shock requires immediate medical attention. Once the incident is discovered, it's important to call 911 right away. And when you get a hold of dispatch, here are some things they're going to need to know. Now, obviously, you're going to answer their questions, but here's some of the common questions you'll be asked. First of all, the nature of the call. What happened? Be sure to explain it was an electrical incident. They're also going to want to know who you are and where you're at. The number of impatients is important for EMS to know as well, so make it clear that you have one injured worker, two if that did occur as well, and any patient assessment information you provide. LOC, the level of consciousness, the ABCs, is the patient has an open airway, if they are breathing, if there's any bleeding, and then also accessibility. Is it off the road, perhaps in a backyard? What height the patient is at, and any hazards, tree hazards and electrical. Also be certain in electrical incidents that you also contact the utility. Do not assume 911 will make that call.
So Pete, what are your options for rescue if you had somebody in a tree like that?
We would prefer to use this piece of apparatus because of the stable platform for our personnel. Come underneath, but if the canopy's such that we can't trim it out of the way, we would go over the top, rig our anchor point off of our own equipment, and then do a high angle rope rescue that way.
And in this case, the worker was unconscious. How does that affect what you guys would do?
That's one of the reasons why we would use this piece of equipment. We could actually start treatment, CPR, package them properly. We don't know if they have a spinal injury, a cervical injury, and we could start treatment as soon as we access the person, and then continue it on the way down.
Calling 911 is an important step in many aerial rescues, so it's important to know how to work with fire rescue and EMS. First of all, when they arrive, they are in charge, not you, so follow their directions. One person on the crew should identify themselves and offer to assist. The remainder of the crew should stand outside of the work zone unless or until their assistance is requested. The crew leader should also offer to point out any hazards in the tree, for example, broken branches or such, and point out any electrical hazards as well. They should also offer to assist in the rescue if they have the equipment and capability, but do not be offended if they just want you to stand on the side and they're going to do the rescue themselves.
Electricity poses special hazards for workers aloft and on the ground. It also poses risks to rescuers. One risk for workers on the ground is through touch potential. This is when an object is energized, a truck, a chipper, a tree, a rope, and the person contacts that object. They can be shocked or electrocuted just through that touch potential. Another risk is through step potential. This is when electricity is passing through the ground. This could be from a downed wire, a truck that has been energized where the electricity is passing through the outriggers or the tires, or a tree. The closer the person is to the point of contact, the greater the voltage, and therefore the greater the risk to the person. However, we do not know how far away lethal step potential voltages can be in any given situation. The safest thing for a rescuer to do on the ground when there's a chance of step potential is stay as far away from the point of contact as possible. If a worker on the ground feels tingling through their feet, in the case of step potential, they should put their feet together and slowly shuffle backwards away from the point of contact.
Tim! Tim!
What do you need,
I
Chad?
lost controls up here. I don't know if a hydraulic broke or what's going on. I don't got any controls. Can you throw up my climbing gear so I can get down?
All right, I'll send you up a throw line. You can lower it down, pull up your saddle and rope. I'll go get the throw line.
Okay, thanks.
Self-rescue is a very important part of aerial rescue. Every aerial lift operator should know the proper procedures for getting themselves out of a disabled bucket. Follow the manufacturer's and your company's recommendations for this process.
You know, Tim, an open canopy rescue like this is one thing, but what about a spar?
Yeah, John, let's take a look at what a pole top rescue would look like. Pole top rescue may be more challenging than other types of rescues. Because the top of the tree has been removed, you may not have a convenient place to tie in to remove the injured person.
Well, we've seen a variety of rescues here.
Jan, we tried to show a couple different ways of doing rescues, but you really have to be prepared for the type of rescue you could encounter.
And that's why it's important to practice for more than just one.